Today we're going to talk about body contouring as it relates to massive weight loss. Most patients who've had massive weight loss have done so through a lot of hard work with diet and exercise, or with a gastric bypass or gastric banding. And regardless of how you lose your weight, it can definitely be treated. And when I talk about massive weight loss, I'm talking about 100 pounds, 200 pounds, and sometimes even up to 300 pounds of weight loss. And as you can imagine, that's a bit of a different concept than, say, having a child and you have some loose skin in the abdomen, you need a tummy tuck. If you've lost 100 or 200 pounds, it's a little bit of a different problem and a bit of a different approach. So, when I see patients in consultation, basically talk about what their priorities are, and almost always the number one priority to improve is the abdomen. There's typically overhanging skin. There can be hygiene problems, chronic rashes, discomfort due to the hanging skin, and oftentimes this can be treated actually as a medical condition, and performing a abdominoplasty, which is a tummy tuck, can be paid for by insurance, and that's usually our goal, and oftentimes possible. Now you can imagine that if you have extra skin in your abdomen, you probably have extra skin from the flank and buttock area. And another concept would be to do a circumferential procedure called a belt lipectomy, tummy tuck plus buttock lift, lower body lift. These are basically terms describing the same thing, and that's a circular incision going around the body at the level of the waistline. And what is great about that incision is that as you do a tummy tuck only, the incision comes down to a point and then has to end somewhere. And as the incision comes to a point, you're taking less and less skin. And so the flanks and buttock are really not treated at all with a tummy tuck. So if you don't have the end of the incision, you can continue removing that extra tissue all the way around the corner and produce really a very nice waistline, and elevate the outer thigh and buttock at the same time. So I like that combination for massive weight loss, because I think it looks great and it's really not that difficult to do. You can also move on. Other priorities can be thighs and arms. And thighs and arms are typically slightly lower down in the priority list, but again, typically problematic for just about anybody who's lost massive amounts of weight. Couple problems with the extremity lifts, and that is the scars. And so for an arm lift, otherwise known as a brachioplasty, it's a scar typically that goes from the armpit down to the elbow. And it's a very powerful incision, and it can really take care of that draping skin well. The problem with the surgery, though, is the scar. And there is a trade-off between the relatively poor scar with the nice contour, and that's something we discuss because there is a trade-off. Occasionally you can do what's called a mini brachioplasty, and that's to basically remove skin upward towards the armpit, so that the scar is only in the armpit and not going down the arm itself. And that's useful for people who really have less laxity than the typical patient that's confined mostly to the upper half of the arm. And that's a very nice surgery because the scar is generally well hidden. Thigh lift. Thigh lifts are interesting surgeries because they have a lot of different experiences and stories, and patients are oftentimes leery about the concept of thigh lift. And I actually think thigh lifts can be quite simple to do and recover from. And interestingly, the longer the incision and using the incision that goes from the groin to the knee, the easier the recovery and the better the result. So thigh lift scars that are done completely upward only as a crescent excision that goes right up into the groin. Although the scar is shorter, I think it's oftentimes less powerful of a result, and a glitchy incision that tends to have some healing problems. And interestingly, the inner thigh scar that goes from groin to knee heals surprisingly well, in contrast usually to the arm scar. So other areas to contour would be breast, and breasts are fortunately the simplest of the contouring procedures. Very little pain, very simple to do. Mastopexy is the surgical term. Oftentimes an augmentation is necessary with an implant, and those are very simple to do and don't tend to cause a lot of downtime. So, do you do all these surgeries together? Do you do an arm lift, breast lift, abdomen, buttock, and thigh lift? Usually not, but occasionally you can. And in selected patients who are healthy, not overweight, have purely deflated skin, aren't heavy, it is actually possible to do all those together. More commonly, 2 stages would be done. So for instance, a abdomen and buttock lift, and perhaps a arm lift, and then as a second stage to do a thigh lift and one of the other procedures. So thighs and abdomens are the 2 more difficult, and so combining thigh and abdomen oftentimes is best done only in selected patients. So although abdomen typically is the only one that is improved by insurance, sometimes other areas can be. So if you have large breasts, perhaps a reduction would be indicated, and occasionally even a thigh lift can be indicated and paid for by insurance. And those are things we obviously talk about in our consultation. So I do work closely with Doctors Ergow, Wynn, and Peters. They are the large bariatric surgery group at Christiana, and I have a great relationship with them, and I think they do great work.